to start on the far right with the underwriters.
Good evening. My name is Lonnie Fleming, and I'm the president of the Houston Association this year, and I'm going to introduce you to my panel. Just tell you just a little bit about myself. I've been in the insurance business for 30 years. Focus on employee benefits. I'm a partner with Core Benefits, and we've got Joe Middleton over here, and Joe is co-owner with Trademark Insurance Agency. They specialize in individual and small business owners. Joe is currently our ledge chair, and she's the only member here that we've got that's going to be able to answer questions for you about national health services because she's a citizen of the UK. And right here next to me is Rand Hall. Rand Hall is from right here in this area. He's the founder of Lone Star Health Plans. His areas of expertise include benefits, pension, 401k, business and estate planning, cafeteria plans, mutual funds, payroll deductions. He's also a registered rep with Woodbury Financial Service, and he's a past president of the Houston Association of Health Underwriters. And this man right here next to me is Ken Yonda. And Ken is the president and CEO of Community Health Choice, Houston-based managed care organization that provides managed health care plans to low-income families, including Medicaid, children's health insurance programs, and the perinatal health plans. CHC is an affiliate of the Harris County Hospital District, and Ken was formerly president of the Houston Market for Humanity. And Jay Danella specializes in wellness. He's been a healthcare consultant for 25 years. He's a past board member for the Houston Association. He's a past president for the Gallery Rotary Club, past committee chairman for the Houston Wellness Association, a past board member for the Human Resources Management Association. He's the chairman of the Galleria Chamber Health and Wellness Committee and president of the Community Health Charities Leadership Board. He has 3 daughters and he's been married 22 years. And we want to also welcome you here tonight. We're here to answer your questions and concerns on how HR 3200 affects you and your family.
My name is Greg Howard. I'm an anesthesiologist. I lived in Sugar Land here for about 12 years. I work at several different hospitals. I do mainly anesthesia, but also pain management. And then about 25% of the time, I take care of patients that aren't that have fallen through the cracks and haven't been helped by conventional medicine. And there's many procedures that aren't covered by Medicare, like acupuncture and other devices. And I see some of my patients out there that helped. And that's kind of my message, that Medicare hasn't been, the fee schedule doesn't reimburse the procedures that are always the best.
Thanks for coming on this evening. Usually the goal is upstanding karaoke here, so this is first time, sort of just size of the crowd. But anyways, I own a drugstore chain called Life Check Drug, 23 drugstores across Texas, and the healthcare reform, how it will affect your ability to get prescriptions, it all depends on, obviously, like everything else, reimbursement. I will tell you that the government seems to think that there's all this money on the table that they can pull out of my butt and his butt. And it's just not there. If you don't believe me, you look at any of the 10Ks or the balance sheets, income statements of Walgreens, CVS, including myself, you're looking at a net profit margin of 2 to 3%. So, so you really, there's not a whole lot of room left to come. Just because to make it zero, and obviously it will look at we're just not doing it. And they would have to make a profit. This country was built on capitalism. It's a good thing because capitalism. Walgreens honest, actually, I think CVS keeps them honest, but I do my best to keep everybody honest. And then the free market, you have competition, and then it drives the price to a natural. Because Adam Smith would say he doesn't pay, which I believe in. But anyhow, and you're going to add all these ideas on real reform that nobody really wants to hear in our current Congress.
Ron Posey, private practice family physician here at Sugar Land. I've been here for 15 years. In a group of 6 primary care physicians. We see babies to 100-year-olds, and we're on the forefront of medicine. And I believe there is some waste in medicine, but I just don't think the government's going to fix the problem.
Hi, my name is Vinny Bajo. I'm a general surgeon in this area. I've been here for about 9 years, minus the year that I spent going for the Army and coming back. Thank you very much. And all of my friends in the uniform, thank you, including a few veterans out there that we have. Dr. Crump, Dr. Mark, as well as Congressman Olson, who's a veteran, any other veterans out there. Medicine in the public form, as military, and in the state form, agency form. I do work for the University of Texas at the county, and I'm in private practice until last November. So I've seen all aspects of it. The healthcare business needs to change, as other people have pointed out. We just need to have people who are much more familiar with the bad processes that exist out there to help them get fixed rather than making brand new process that doesn't involve all those processes. So everything needs to be considered. I'm not sure it's all in this bill, but everything does need to be considered as well.
I'm Charlie Crump, CRUMB like bread. I'm a nephrologist, first nephrologist in Fort Bend County. I've been here forever. I burned up my copy machine today making a copy of the bill. Our medical system is very good. It has quite. But dismantling the current system for an unknown system, I don't think is the best way to do it. I was a nephrologist and ran the VA hospital in Little Rock back in the mid-70s, and it is not very efficient. So I think that the private sector has to be involved.
I'm Tom Clark, orthopedic surgeon, private practice. Yes, I put together the panel stacked with Charlie, who is a paratrooper, and Bajwa, who served as the surgeon in Iraq, at least 2 tours plus the backup time, and I'm a former Ranger, so excited to meet this guys. I was 2 years ago, so I'm a fellow differ. I get TRICARE and whatever insurance I can find to afford to pay for. But as a solo private practitioner, it's harder and harder for me to find insurance I can pay for. Because I have a purchasing power of 7 people. And I'm a gnat. I used to think of myself as a dinosaur in a solo private practice. I'm really just a gnat. And I feel sorry for the other gnats. Those working folks that want to buy insurance and can't because of a pre-existing condition or because it's just so plain expensive. And yes, I agree with the folks that we've heard so far. Our system needs tweaking. It doesn't need throwing out. And